Joining us now is John Ivison, political journalist and Ottawa bureau chief at the National Post. Welcome to the show, sir.
Hi.
So let's start with what's hitting the headlines the most right now. Lockdown restrictions, while some political leaders have been found to have left the country. How are these developments affecting Canadians' perceptions when it comes to following health guidelines, sir?
Well, I think it hits public trust. And public trust is pretty crucial. I mean, I think that there's only a certain amount of enforcement that any government can do. We saw at the outset of the pandemic that people obeyed what they were basically did what they were asked to do because there was a fear and concerns about the effects of COVID. I think some of those have worn off, and we're relying on people to behave well and follow the rules, and yet the people who are setting the rules are not following their own rules. So I think that undermines everything that governments are trying to do.
And in terms of the vaccine program, why is it that Canadian snowbirds who flew to Florida had such rapid access to a vaccine, whereas it would likely take months before that demographic would have access to one in Canada?
Yeah, I mean, that is kind of shocking. That I spoke to somebody who was in Florida this week who was in a gated community. The local county in Florida was financing vaccine for everybody in that community as long as they were resident and over 65, regardless of whether they were Canadian or not. The fact that we are so far behind, in some ways, vaccine is produced in the US. We always knew that the US and UK and even Germany might have more vaccine more quickly. But Canada has not done a great job here. I think we were late coming to the party as far as signing up all those vaccines. The fact that we're not going to be have herd immunity and mass vaccinations until September, according to the government schedule, is kind of shocking. I mean, there are going to be an awful lot of people who die before they get the vaccine if that's a schedule we're on.
Now, the Prime Minister seems to agree with those sentiments, saying that he's unhappy with the number of COVID vaccines stored in freezers rather than being administered. But are current efforts to scale up vaccinations right now enough?
Well, the federal government is obviously trying to deflect blame away from itself towards the provincial governments, who are equally irate that the Prime Minister is blaming them and saying that there's vaccines sitting in freezers. Doug Ford, the Ontario Premier, is saying there is no vaccine sitting in freezers, and they would put more into people's arms if there were vaccine available. I think the truth lies somewhere in between, that governments at all levels have not performed particularly well during this pandemic. The general strategy, the broader strategy, is to try and contain and manage the number of COVID cases, and we're seeing that is not particularly they're not particularly performing well. Ontario had its 3,500 new cases on Thursday, the most deaths that it has seen since the pandemic started at 89. The numbers in Quebec are skyrocketing too. 2,500 new cases in Quebec on Thursday. The hospitals in Montreal are stretched beyond limits, which is why the Quebec Premier has introduced new lockdown restrictions, including a curfew. So at some point, you've got to say, well, this strategy is not working. We've got to do something else. And frankly, the Quebec lockdown, I don't think it went far enough. Schools are still open. There's no restrictions on the workplace. They haven't required workplaces to close down. And I think that at some point, governments are going to have to grasp the nettle. If they really want to avoid a third wave, which I think is almost an inevitability at this point, they really have to lock down far harder. And I understand, I've got 3 kids. I understand the implications of that for mental health, for schooling, for businesses. But with a good short, sharp circuit breaker, there's a prospect that we could get these numbers under control. If not eradicate COVID, at least get the numbers so low that it saves a lot of lives and we don't have a third wave.
All right, Mr. John Ivison from the National Post. Again, thank you so much for joining us on the show today, sir.
Okay, thank you.